How do positive and negative reinforcement differ in CBT? Imagine trying to teach a dog new tricks. You might give it a treat when it sits or take away a loud noise when it behaves. In therapy, we use similar ideas to help people change. In cognitive behavioral therapy, positive reinforcement and negative reinforcement are two key tools. They both help increase good behaviors but work in different ways. Positive reinforcement means adding something pleasant after a behavior to encourage it to happen again. For example, if a client practices deep breathing when feeling anxious, the therapist might praise them or suggest rewarding themselves with something they enjoy. This makes the client more likely to repeat the calming behavior. It's like giving a high five after a good effort. Negative reinforcement, on the other hand, involves removing something unpleasant to motivate the behavior. Say a person feels overwhelmed by negative thoughts. When they use a coping skill that reduces their anxiety, they experience relief. This relief acts as a reward, encouraging them to use that skill again in the future. It's similar to turning off a loud noise when you press a button. In the context of scheduling positive activities, positive reinforcement is often used to motivate clients to engage in activities that boost their mood. For example, a therapist might suggest scheduling enjoyable activities like walking or listening to music. When clients follow through, they might receive praise or a sense of accomplishment, reinforcing the behavior. Negative reinforcement can also be involved when clients learn that doing certain activities helps them avoid negative feelings. For instance, if journaling helps reduce feelings of sadness or anger, the client is more likely to keep journaling to avoid those unpleasant emotions. Both reinforcement types aim to strengthen behaviors but do so differently. Positive reinforcement adds a reward after the behavior, making it more appealing. Negative reinforcement removes discomfort, making the behavior a way to escape or avoid unpleasant feelings. In therapy, these techniques work together to help clients build healthier habits and reduce distress. When a client practices a new coping skill, positive reinforcement can motivate continued effort. When they experience relief from anxiety or sadness, negative reinforcement encourages them to keep using that skill. Understanding how these reinforcement methods differ helps therapists design better plans. They can choose to reward progress with praise or help clients avoid negative feelings by learning effective coping strategies. Both approaches support lasting change by making positive behaviors more appealing and reducing negative ones.